Welcome to HIMS TV. I'm Laura Levitt. I'm the managing editor at Moby Health News. Today we have with us Renato Lopez, who is the chief creative director at Very Big Things. Welcome.
Thank
I'd
you.
love to start off talking a little bit about what the company does. I know that you're sort of adjacent to healthcare. How have you gotten involved with healthcare companies and what is your sort of position in the space right now?
Well, Very Big Things is actually a leading digital products agency that helps startups, create disruptive products. But we also help enterprises digitally transform in the space. And in the digital health sector, we're seeing a lot of companies needing to accelerate their growth in order to feed the demands of the users, right?
Yeah, so the next I'd like to talk about is COVID changed healthcare and changed pretty much every industry. What are you seeing from your end? How has COVID sort of impacted the industry? And also, how do you see it impacting the industry down the road?
For sure. What we are seeing is an acceleration, right? There was a need and desire basis for healthcare products in the past. Most of the time we would see yoga studios, mental health. You had places like Calm, Headspace, but COVID hits and suddenly and immediately every legacy enterprise company or medical or healthcare based industry now needs to give their services to the user in a way that's going to be safe and expected, right? So what we're seeing is an acceleration in order to update these companies and transform these companies. And it's forcing these legacy providers to also update the way they interact with consumers, right? I think for the future, what we're going to see is that need to personalize more experience, right? Not just give the offerings of their services that they had and make them digitally accessible, but really personalize with people, empathize with people, and ultimately be able to really truly solve their problems as opposed to just giving them a place to communicate their woes, so to speak.
Yeah, and I'd like to talk a little bit about this with design thinking, especially personalizing, meeting the patient where they're at, the provider where they're at. What are you thinking about when you're working with digital health companies or even providers that are going digital when you're trying to incorporate all these users?
Oh, that's a fantastic point, actually. As a digital products agency, you always have to think about, your client as a user, but the most important one, right? The end user. We're trying to serve people, we're trying to help people. And the only way to do that is, as you pointed out, is with that design thinking. You want to have that human-centered approach. So the way that we do that is first you have to really understand what the landscape of any of that the business's offering is and how they could provide that in a digital way, but then moving that on to user testing, trying to create focus groups of the end users that you're trying to help. And with that information you go into iteration, rapid prototyping. You really want to create new innovative ideas how to serve those people, and not just do what the minimum they expect, right? Back in the day, you would have a call center with somebody would just leave a note, right? But nowadays, you really want to open up an app and say like, oh, they know about this. Oh, and they anticipated my issues, and now they can help me.
I think one thing that's been really interesting is during COVID, a lot more users have come on to digital. So, people who maybe were going in person, maybe even using the phone, were starting to use digital. In terms of when you're designing and working with different companies, what's important to think about for those perhaps new users to sort of adopt technology?
That's another great point. Well, people are getting used to certain things based on their desires, right? We have places and industries and products. A couple examples are like Instacart or Uber or Airbnb, right? We're all familiar with those, and we're thinking, oh, I can get my groceries, I can get a transportation, and I can find a place to stay at, right? But as we move into the digital health products, what we're really seeing is that we're also going to expect to have those same experiences, right? Which is like, hey, I need something more than just logging into an app and then being able to file a complaint, request an appointment, right? A lot of people would say like, oh, I just need to go schedule an appointment. But it's not just that. Is I want to change my appointment. I want to talk immediately with a medical expert. I want to tell them how I'm having certain feelings, whether it's like mental or physical, and so I think that's changing the way that the way that the industry, the leading industry businesses and enterprises are shifting their business models because of that, right? It's not going the other way around. Consumers are going to lead the charge in the future of the digital health space as how to be treated by these larger companies.
Yeah, I'd love to actually jump off of that. You mentioned retail, Uber, things like that. What can the health space learn from, retail giants, tech giants, financial, companies even are now doing a lot more online banking. What lessons learned are there for healthcare, and maybe what's different too?
I think that's probably one of the most important points, which is there's a lot of value in user experience design. There's a lot of value in listening to to your clients, consumers, patients, right? We're used to the unification of data. For example, you mentioned our banking online, right? But you can also go to companies like Credit Karma and see what accounts you had 10 years ago, right? So as we move on to the digital health space, what we can learn is that it pays off to listen to those users. It pays off to do a little bit of research to see what their pain points are. For example, if you have a different insurance company right now, you might be asked to change your primary care physician, and then you almost feel like you have to start from scratch. But if there's a way to unify that experience and provide that experience digitally to a user where you're not worried about starting from scratch, right? You can go back and see in the digital space how that digital space stored that knowledge to help you not have to explain your problems again, right? So there's a lot of value in user experience design, and I think that's what these industries can learn from, the retailers and the new transportation and other sectors that have been doing this.
Now, you have a lot of experience working with different companies sort of across the board, like we were just saying. What is your biggest advice to healthcare companies coming on to this digital stage today?
Human first, I would say. It sounds a little cheesy, but it's the truth. We are people at the end of the day. We have to wake up in the morning and not necessarily drive to work, but you still have to get dressed and get coffee and get ready for work. So anything that you can do to learn the habits of your users, the needs of your users, the pain points of your users, whether that is through design thinking and that human-centered approach, right? Rapid prototyping to see what they like and don't like, what they understood and didn't understand, right? Which is very important. Sometimes we have biases, especially when you're a subject matter expert, for example, in the health industry. You might say, well, everybody knows what this or that service is, but they might not, right? Just in the last 2 years, which in digital space is forever, right? We tend to change a lot of naming conventions and understanding of how technology should work, right? So that would be the most important thing. If you learn the habits, the pain points, and the nuances of the people you're trying to serve, then real people can benefit from you. And if real people can benefit from the services that you offer, the stronger the likelihood for them to create a connection with you, right? As a company, a real connection and not one that's driven by advertising.
Well, thank you so much for coming on and talking to me a little bit about, design thinking and your process working with these different digital health companies.